Hey everyone, what is today? Today is Wednesday. Happy Wednesday. Um, so excited to be here again this week for the fourth webinar in our series leading up to election on November 6th. Today we're going to be talking about the healthcare and disability policies that you need to be aware of, and just make sure that what you are looking for in a candidate is who you want to vote for in the election. So Molly and Zack will be joining me here very shortly. Here they are. I think we are getting them in here. Yep, they should be here any second. So Molly and Zack are here again this week, and they're going to share a whole lot of information for you guys.
Nope.
Here they come. So we've got today's handout. I will get that pinned in the comments in just a minute, but we have today's handout. It's two-sided, so Molly's got a lot of notes for us. Yeah. There's a lot to talk about when it comes to healthcare and disability. And so I'm very happy that they're here again today. Molly and Zack, they work for the Minnesota Brain Injury Alliance on their public policy team. And do you guys just want to give your 30-second intros?
Sure. Do you want to kick us off?
Yeah, I'm Zack Eichten. I am a direct lobbyist here with the Minnesota Brain Injury Alliance. I've been here since June, and we're excited for the upcoming legislative session.
Hi, my name is Molly. I'm the grassroots lobbyist for the Minnesota Brain Injury Alliance. So that means I coordinate a lot of our citizen advocates, making sure that they feel like they can access kind of the political sector. And yeah, we got about 2 weeks for the election, and we're dying a little bit, but it's a good thing. And we're just trying to make sure that people yeah. And I mean, we're just trying to make sure that people with brain injury vote. So it's a good kind of busy for sure. And like Amy said, today we're going to talk about a number of disability priorities to kind of prep you for doing some candidate research prior to the election. Of this, we're going to spend the majority of our time on healthcare, because that's going to be a big issue in a lot of the races that are going to occur. And also because that's something that's really relevant to the lives of people with TBI, and we want to make sure that you understand those policies. They're also kind of complex, so they need a little bit more time to be explained. But we'll touch on a couple of other priority issues like transportation and housing at the end as well.
Awesome. Yeah, and I went and voted yesterday at our city hall, so I am officially done. I had this recurring nightmare that I was gonna be sick on election day or something and wouldn't be able to make it, so I made sure I got it out of the way. And here in Minnesota, we're very fortunate we can vote early. And so I've worked with you guys. I've worked with the Brain Injury Alliance a lot the past couple years, and the Tuesdays at the Capitol during session. And I know that healthcare has been a very big priority, and Medicaid. And I know you're kind of breaking it down here on this sheet. So I'll let you guys who's going to lead off here with the healthcare, and I'll let you guys kind of take it away.
Sounds good.
Alrighty. Yeah, and of course, if you have any questions, feel free to put them in the comment section, and we'd be happy to answer them as we are live. If not, make sure you post them afterwards. If you're watching not live, we'll be checking back for any comments that come in, and we'd be happy to answer anything that you have questions on. So as Molly mentioned, we're going to start off with healthcare topics and look at how healthcare is very complex, obviously, and especially for folks with disabilities and TBIs, that there's a lot to cover about what policy can do for your healthcare coverage. And politics, of course, plays a role in that. And it's important for you to know how to look at some of these issues so that when politicians put their spin on things, you can kind of see through that and see what are the issues that you really need to care about when you're looking for who to vote for in the upcoming election. So we're going to start off talking about Medicaid. So in Minnesota, that's known as medical assistance, and it's named a couple different things in different states. And essentially what it is government health care for folks who are low income, who have a disability, who are over 65, and if you've expanded, single adults, and then there's children and parents of young children as well. So there's a lot of people that could be covered under Medicaid. And essentially Medicaid is public insurance for these folks, and it covers 1 in 5 Americans nationally. And it covers quite a bit of Minnesotans as well. Nearly 200,000 Minnesotans with disabilities are on Medicaid. So it impacts a huge swath of folks who are looking for that sort of insurance and looking for that safety of mind, so that they will be covered in the case of any life-threatening emergencies. So as I mentioned, Medicaid has a bunch of different names over the entirety of the U.S. So it's not always called Medicaid. It's medical assistance. Connecticut was Husky Health. Like there's a whole bunch of different names for it nationally. Hold on, I gotta move this because I am covering up the comments, so we can make sure that we can hit all the stuff. So, come on.
Sounds good. So one of the big questions that we get asked is, what's the difference between Medicaid and Medicare? And unfortunately, they have kind of similar names, which is not great because people get them confused. The main thing to remember is that Medicaid is for people with low incomes, and Medicare is for people over 65. So if you're old, if you're a senior, if you're elderly, you're probably on Medicare, and if you're younger, you're most likely on Medicaid. But Medicare is an example of a single-payer healthcare system for people 65 or older, which means that it's funded by the taxpayers. It used to be run through the Social Security Administration, but now the organization that coordinates it is the Center for Medicare and Medicaid Systems, otherwise known as CMS. And so they now kind of run the program.
And Molly,
yeah, go ahead.
Also, is Medicare is also those who are on SSDI, no matter how old they are.
Yep. To some extent, yeah.
Yeah.
And then, so Medicare covers a wide variety of things. It can cover people with disabilities, especially if they're younger. So there are circumstances where you can be on both Medicaid and Medicare at the same time. That's not particularly unusual, and is certainly relatively common in the world of people with disabilities. Medicare covers a number of healthcare treatments. It covers hospital stays. It covers outpatient work, so like your check-in, stuff like that. And importantly, Medicare Part D also covers pharmaceutical drugs. So if you're on any sort of medication long-term, Medicare can help pay for those medications. There are kind of a couple ways, and we'll get into this later, of accessing Medicare. There's the original Medicare, which provides services in a certain form of way where you go and receive services and then the government pays for them. There also is the Medicare Advantage plan, which you may have heard about recently. We're going to talk about that a little bit later, where you contract through a private company to get those services, and also the Medicare Supplement Plan, otherwise known as Medigap. They just provide slightly different services under the umbrella of Medicare, and so people can kind of pick the program that works best for their lifestyle and their needs, but they're all about the same, and they all provide about the same amount of coverage. All right, we'll switch again.
Yeah. So another component to medical coverage, and this is what a lot of folks focus on and actually are on, is private insurance, and the role private insurance plays in providing health coverage for folks. So private insurance is purchased through a non-federal organization, and 49% of Americans actually get their insurance through such things as like employer-sponsored benefits. So while they're working, their employer provides benefits to them as part of their compensation package, often in the form of healthcare. And you can buy private insurance outside of being employed as an individual, which is what a lot of folks do as well. but it is definitely the largest component of what makes up the private insurance pool is that employer-sponsored benefits.
Okay. So next we're going to talk a little bit about some of the buzzwords that you often hear, especially during election season. There are a lot of just big words that people throw around willy-nilly and never define. You'll hear it on CBS or Fox or whatever you're watching. So we just want to give you some background as to what those words mean and the policies that they're rooted in. So the first one we're going to talk about is Obamacare. And I'm sure all of you have heard either Democrats being yeah, we love Obamacare, we can never repeal Obamacare, or Republicans saying repeal and replace Obamacare. They just shout it and shout it and shout it, and you always hear this word. But what a lot of people don't know is that Obamacare is actually not the name of the program. It's actually called the Affordable Care Act, or the ACA. And so that program was passed into law under President Obama, which is where it got its nickname, in 2010, and did a couple things to reform the healthcare system. There was another piece of legislation that passed around the same time, and those two pieces of legislation together are considered the largest federal healthcare reform that we've had in decades. So it was a really, really big change. Fortunately, Obamacare didn't change too much in terms of Medicaid and Medicare in the general spheres, but what it did do is it expanded coverage for Medicaid to include people who weren't previously covered. So that's what's known now as the Medicaid expansion, and Amy's raising her hand because she's benefited from that program, and that's a really, really great resource. Because there were formerly a lot of people who didn't have children, weren't part of families, so couldn't get coverage that way, didn't have disabilities and were elderly and couldn't have coverage that way, but they were still low income and still without health care. So the ACA made some reforms, provided an opportunity for states to create the Medicaid expansion pool, which is individuals without children who are low income. Unfortunately, there was some legislation, or not legislation, there were some court cases in 2012, went to the Supreme Court, that determined that not every state is required to provide expansion. Fortunately, we live in Minnesota, and we do have a Medicaid expansion that's protected, but that's not always the case in every state. So if you are interested in looking into that program, look into your state specifically. Obamacare also changed the individual insurance market. That was the largest change that it had, because previously, if you were buying insurance as an individual, so I get my insurance through the Brain Injury Alliance, but if I didn't, say I didn't have an insurance plan, I'd have to go out into the individual market and apply for insurance coverage. And I could be denied because of a pre-existing condition, because of my gender, because of my age or my race. And so it was really hard for people to find insurance coverage when they were in that situation. And so what Obamacare, the ACA, did was mandate that an individual insurance coverage couldn't discriminate based off of things like gender or race, and that they had to include pre-existing conditions. They couldn't exclude people who were applying from that. The other really, really cool thing about it is that I just lost my train of thought. There was one more cool thing. What was that? There's a child playing outside and I looked at it, which is cute baby. Individual insurance market. Yeah, maybe we'll come back to it if I think of it. There have been a number of there have been a number of occasions where individuals have attempted to repeal Obamacare. We saw the big repeal and replace, confusingly known as the AHCA, that's what it was, that was trying to create a different policy that wouldn't have all of the same requirements as Obamacare, and that fortunately failed in 2017. So that's kind of in the recent political mind. So just some stuff to look out for as candidates are talking about Obamacare. That's really the root of the program.
Mm-hmm.
Yeah, so something Molly brought up throughout that is something called a single payer system. And that is what Medicare is for folks who are 65 and older. But single payer systems aren't just Medicare. In fact, they've been instituted in a lot of other places around the world. A lot of different countries, such as Canada or the UK, have single payer systems as well. And essentially what that is healthcare funded by taxes instead of paying into private corporations. So the United States has a multi-payer system because individuals and their employers pay into a system that can cover a range of healthcare costs. But universal healthcare is sort of what that single-payer system is trying to get towards. So instead of everybody paying into a private corporation and then that private corporation gives you insurance, so if you get sick, then they can cover your healthcare costs, everybody pays taxes that go into the healthcare pot, and then that healthcare pot is what pays the doctors to do the healthcare. So there would be no middleman, there's no insurance companies. You pay in, and then you can go to the doctor whenever you want. This is essentially the gist of what single payer is designed to be.
Sounds good. So kind of off of that thread, one thing you'll hear a lot too in the campaign sphere is Medicare for all. And that's like kind of this tagline that really started after the 2016 election. And Medicare for all is basically a specific proposal or a plan to implement single payer healthcare. And so Medicare for all draws off of the idea that we already have a single payer system in the US, and we just need to expand it to everybody, not just people over 65 and people with disabilities. So it's just like another tagline. It's been a major talking point among progressives. It was kind of coined by Bernie Sanders. He's really the major proponent right now. And there are a number of pieces of legislation working their way through the federal legislature that address Medicaid or Medicare for all. And you'll see that in a lot of debates coming up. I was just listening to a debate between Minnesota Congressional District 2 candidates, and they were talking about whether they support or don't support Medicare for all. So it's a really, really big talking point, and something that you just have to understand is another way of referring to single payer healthcare.
All right, and then we're just going to quick touch on Medicare Advantage plans. So an Advantage plan through Medicare it's a supplemental insurance provided by a private entity to sort of plug the gaps that Medicare has. So Medicare has a very basic plan, and then you can get additional coverage to sort of fill in the rest of what's not covered exclusively by that original Medicare. So those are that's sort of what those Medicare Advantage plans or MA plans are. So we bring all this up because it's important to recognize that healthcare is very expansive, and it took us, I don't even know, 10 minutes just to go over the basic definitions of what each of these are. So to get a good grasp of all of these systems, you're not going to get that from a 20-second campaign ad or anything like that. And it's going to be really hard to pin any of these folks who are campaigning down on where they stand on specific issues. So it's kind of up to you, and we're going to be going over how to do this in the next webinar, is research the campaigns and find out these answers yourselves, because you're not going to get them in their scripted responses, because they don't want to give it to you, and even if they did, it's way too complicated to get across in the short time span that they have on those ads. So if you're on Medicaid, for instance, and you have an income and asset limit, you're not going to be able to figure out necessarily where they stand on that sort of specific issue. So that's where the campaign researching and candidate researching come into play, and try to dig deeper into that. And we'll give you the tools so that you can do that as we get to next week's session.
Definitely. And like I said at the beginning, while healthcare is an enormous issue for the TBI community and the brain injury community as a whole, it is not the only issue. So we also just wanted to quick highlight a couple of other issues that you may have experienced, you may not experience, but your community experiences, so that you have awareness of the context, so that when you're doing your candidate research, you have a firm understanding of kind of what you should be expecting to see. So the first thing we're going to talk about is transportation. And one of the major hurdles that a lot of the folks that we work with face is getting to where they need to go. Because a lot of times when you have a brain injury, your ability to drive can also go. Even if it's just temporary, that can still be really, really different, and that can be a challenging hurdle. And so we want to make sure that transportation is affordable and available and accessible. because it's important that people are present in their communities and have the ability to go do the things they need to do. We wouldn't be able to have advocates at the Capitol if we didn't have strong transportation here in Minnesota, because how would they get there? And so transportation can come in a variety of different ways. One thing you'll see a lot of politicians talking about is funding for roads and bridges, and they'll say it that way too. And that's a really good thing, right? Funding for roads and bridges, that improves safety, it improves some great things. The one thing you have to watch for when they talk about that, though, is whether they're cutting that funding from somewhere else, because a lot of times roads and bridges funding will come from pools that otherwise go to, you know, health and human services and healthcare services. So you just have to make sure that you watch out where that money is coming from. Overall, benefits to roads and bridges are good. We have to make sure that they're also funding transit for people who can't drive. Other places where you may see politicians talking is about public transit. So that's things like buses, things like in Minnesota, we have the light rail. So if you have any sort of train system, commuter train system, there will be a lot of debates on that, I'm sure. And so those are really cool because a lot of those public transit options are good for people with brain injury. Another thing, though, that we have to keep in mind is disability-focused transit options. In Minnesota, we have something called Metro Mobility, which is a bus service that specifically goes out to the places where folks with disabilities live and provides door-to-door service where they need to go. So if you need to go, you know, get groceries, they can drop you off and get groceries. If you need to go to the doctor, they can drop you off at your doctor's appointment. Unfortunately, that's not something that a lot of folks talk about in their campaigns because they don't see it as something that affects a ton of people. But if you do see them talking about transit, make sure that you're asking questions about how that transit will apply to people with disabilities and make sure that they can get where they need to go.
Yeah, so another issue that is not just facing folks with disabilities, but you know, pretty much everybody is housing and the lack of affordable housing options that currently exist across the country. And we're seeing it really highlighted here in Minnesota, and it's something that we're focusing on and joining coalitions to sort of try to fix the situation, because right now housing is just lacking across the board, let alone disability-specific housing or housing that would be for folks with brain injuries. So essentially, what that means is that because there's not enough affordable housing, a lot more folks are going into unstable environments or even into homelessness because they can't afford to live anywhere. And because of that lack of stability, especially for folks with brain injuries, it can make it really hard to sort of get out of that cycle of homelessness, because if you don't have a stable home life, it's hard to go to work and have a stable work life because you have nowhere to go afterwards. It can cause a lot of undue stress. And then it just gets harder and harder to not only hold jobs, but then find jobs once you are off it. And even if, say you have a disability that would prevent you from working, it is difficult then to even just have that stability to make sure that you can be the most healthy that you can be in any environment. So we are looking, of course, to see what additional funding options there are from both the local, state, and federal governments, and we're working with other folks to do that. And that's something that you should be on the lookout for campaigns as well, because the affordable housing crisis has been on people's radar for a while now. So if it's on their priority list, they will have statements out there around it. It might not be super specific or have necessarily an action plan attached to it, but it is something that folks are starting to care about and look more into.
Awesome. And the last thing we're going to talk about is prevention. And so unfortunately, a lot of brain injuries are preventable. Now, not every brain injury is. A lot of times there are situations that are just unavoidable. Brain tumors, for example, are not super preventable. But some brain injuries that come from things like distracted driving, drunk driving, sports-related concussions, those are things that we can work to shape policies to change. And so that's another thing to look out for is how is the candidate that you're researching addressing public safety? Are they for priorities that reduce distracted driving? Do they want policies that make it illegal to use your phone in the car? well, it seems like those aren't related to brain injury. They really are, because the more accidents that we have resulting in injury at all increases the chances that we're going to have folks with brain injury. And so looking from a public safety standpoint, there are lots of things that that politicians can do to make sure that folks with brain injury don't get them if it's possible. So that's just another thing to keep your eyes out for. A lot of times that's not going to be the first thing on a candidate's webpage, but sometimes they'll talk about public safety, particularly if they have experience with drunk or distracted driving. So just something to keep in mind as we move forward.
Awesome. And so, I guess the message that I kind of want to make sure people get is, don't just listen to all the hype on TV and radio right now, because we're in the midst of, the negative campaigning right now, and they're trying to make you believe that the other party is doing things that they're not doing. And so we really want you to do your research. And I believe, is it next week, the 2nd, we have our final webinar, and we're talking about how to research your candidate. But in between now and then, it's a great idea if you hop on your candidate's websites and really look at their issues, and particularly healthcare, you're going to be able to see pretty quickly on their website which way they side with healthcare.
That is very
it's kind of the hot topic right now. And just knowing, are you affected by that? Like personally, I'm on Medicaid and through the expansion, and so there's several ways that could be taken away from me, and so I'm doing a lot of research to make sure my candidates are going to support Medicaid.
Right. For sure. And the first step to understanding where candidates stand on it is understanding these crazy complicated healthcare policies.
Yeah.
So we're really hoping that this helps you out a little bit. If you have any questions, even after this live stream is done, feel free to pop them onto the comment section. We check those for a couple days after the segment is done. And we also have our contact information on the very, very bottom of that worksheet that Amy has attached to this presentation. So feel free to shoot us an email or give us a call. Even if you're not from Minnesota, we're more than welcome to help you figure some stuff out or point you to some resources that can really help.
for sure.
Awesome. Well, awesome.
Thanks for
Thank you
having us.
guys so much for being here. And I look forward, I'm phone banking with you guys tomorrow night. So I look forward to seeing you guys tomorrow.
Yeah, we had our first one yesterday.
Yeah,
So.
Amy, how come you didn't pick up when I called you last night during our phone bank?
Was that
You
you
were
that
first
was
on my
calling?
list.
I already voted.
I know. I put you down as yes still.
Awesome. Well,
All
thank
right.
you guys.
Thanks, Amy.
And
Well,
thanks
thank you
everyone
for
for
have a good
watching.
one.
See you tomorrow.
All right.
See you next
Bye.
week, everyone.